It's time for the Kim Hammer Show, where you'll learn how your state government affects you, your family, and community. Here's Kim Hammer.
Good afternoon on a beautiful Saturday afternoon, a little overcast as you can tell. You don't need me to tell you that, but just in case you haven't looked outside, it's a beautiful Saturday. Glad to have you joining us on the Kim Hammer Show. We've got a pretty informative show today, as they all are, but we've got a pretty informative show this afternoon with Chris Dickie with Natural State Recovery, and then Lindsay Barclay, and I'll let Chris tell about Lindsay and what her role is in the Natural State Recovery program out there. At 12:30, we're going to be joined by State Drug Director Kirk Lane and possibly Representative Dr. Lee Johnson, and we're going to talk about the drug take-back program that's coming up next Saturday, as well as some other things that are being done through the legislature this time around to help deal with the opioid epidemic and try to take one more step or turn one more notch in getting that under control. And then on the first Saturday in May, I'm going to have Dr. Kent Corso. He's been on the radio show before. He's out in Virginia. Dr. Kent Corso will be coming on, and we're going to be talking about suicide prevention, and we're going to be looking at the different phases of life that affect suicide, whether it's just the high school student or the young adult, or whether it's somebody maybe that has had the sex-altering change, or somebody maybe that is in the military dealing with suicide. And we're going to look at the different segments. That'll be the first Saturday in May, and I'll keep you informed as far as more information as that gets closer. All right, with that being said, let's get Chris on the line. And Chris, thanks for taking time out on Saturday to be on the Kim Hammer Show. Good to have you back on.
Senator, thanks so much. I know we appreciate your efforts to continue this show. I know you're swamped with this session, and so I'm grateful to be on here, and so is Lindsay.
All right. So is Lindsay with you, or is she calling in? I'm in the dark on here.
We're on the same line.
All right, great. Lindsay, glad to have you on the Kim Hammer Show today. And so, Chris and Lindsay, why don't you tell us about how you guys work together, but also you maintain separate roles in your entities. And let's just start off by having that conversation so people understand how you work together, but what you do that's different.
Absolutely. So I'm gonna answer that question and set it up in this way. You know, it's been, I don't know, it's probably 6 months since the last time I've been on here, Senator. So I'm glad to be back on. And last time we were talking about where we were at with construction on the Oak Grove campus that we had bought in 2019. And so we've come a long way. We've weathered the pandemic and have been able to open the treatment center out in Oak Grove, and we did that March 1st. And so 6 months ago, I had a set of stressors in my life, and now they're just different, right? So we're happy to be open, and we are full steam ahead. We like you're aware, addiction in this country, and especially in Arkansas, is alive and well. And so we are taking in new people each day that are looking for a new way to live. And with the addition of our services out in Oak Grove, bringing us detox and residential, we have a full spectrum of care with, I like to say, we can treat from crisis to sustainability, because we can just touch our residents on every level that they come to us with, right? So we know that addiction impacts a person's spiritual well-being, physical, mental, and emotional. And now that we have this new resource under our umbrella, we not only can treat our patients medically and clinically, but we have access to a football field and a track. We built a dog kennel out there. We have a state-of-the-art gym where with basketball, full court basketball, pool table, and just some other amenities, that aren't always available at other places. And we have this auditorium out there as well. But I'm really excited to have Lindsay share about what we're doing out there. And so, Natural State Recovery Centers is the treatment center out there that operates within the campus. But we recently had 501c3 status awarded to us through the Natural State Recovery Foundation. And that is what Lindsay is tasked with to run and build. And so with no further ado, I'm going to have Lindsay share a little bit about how she came into this role and why it's important for our state to have this foundation running.
All right, Lindsay, go ahead and tell us about Natural State Recovery Foundation.
Hi, Senator Hammer. I don't think that you might remember this, but I've actually met you before. And the first time that I met you, it was when I was doing my first tour of Natural State Recovery Center. So I had my interview with Chris, and I wasn't sure if this is what I wanted to do. You know, it was a little bit nerve-wracking because it's a startup, and I had just come back here from Hawaii and was kind of, you know, trying to search for what was in the addiction realm in Arkansas, because I know whenever I was going through my addiction problem about 6 or 7 years ago in Arkansas, there was nothing. I mean, there was hardly any help for anybody who had an addiction problem. And I remember my parents trying to help me, and we just couldn't find what we needed. And I needed that certain level of care. And so I had to go out of the state to get it. So I went to treatment in Hawaii. I went to a 30-month program and ended up staying 2 extra years there to work there. And then eventually I moved back here. And so I had my interview with Chris, and I told him, you know, I'm just not sure yet. He said, well, come see the campus and just see what you think. And then I went out there, and you were there. And I wasn't sure if that's what I wanted to do. But once I saw the place, I knew, you know, just looking at it, it sells itself. I knew I could see the potential and how many people we could help there. But then one of the main things that really swayed my decision to take this position was when you prayed. You prayed with us before we left, and I just felt like I really felt like at that moment that was what God wanted me to do. And so I have a lot of admissions experience. I was in charge of admissions at the treatment center that I went to, so that was my original role here at Natural State. But I just transitioned into executive director of the foundation, and one of our main goals to begin with is going to be helping, you know, making relationships and helping basically build funds to scholarship people. That's one of the biggest things. You know, myself going through a 30-month program, sometimes I have a hard time wrapping my brain around 30 days. And we can go further than 30 days, but, you know, a lot of the times people only want to do 30 days, or insurance will only cover 30 days, and then they've got to transition into our outpatient. And so one of our biggest goals is going to be able to scholarship people who need longer term treatment. And then one of the most exciting parts about this role so far is that I don't know if you remember. Do you remember doing a tour of that auditorium at our campus? Did you go in that building?
I did. And as you were talking, I remember meeting you because, yes, that was like 6 months ago. You and 2 other ladies were there, and Chris, and we took the tour. Yes. And when you said from Hawaii, I know exactly who you are. And by the way, you made my day today just by what you said about, you know, hand to God moment there with the prayer. So I appreciate that. But yeah, I remember going to the auditorium because it has a lot of potential to do a lot of things. And it's actually was in pretty good shape. It could use some updating. You know, the 1970s look will need to go away. But go ahead and tell us what you were talking about, Lindsay.
Yeah, so we've gotten it cleaned up a little bit since then. We're still working on a few things. We're going to get some lighting. You know, some of those bulbs have burned out. It's been so long, so we're going to get it fixed up. But one of the biggest things is I go to a church called Living Truth in Mayflower, Arkansas. And I recently found that church in, I think it was about December. And it's a small church, but I got invited by a family friend, and it changed my life the second that I walked through those doors. And so we've got a pastor there named Blake Harrell, and he's a pretty young guy. He's different. We're all about being real and finding the Spirit and trying to really, you know, build a presence of God in our lives. And so I was leaving church one day, and I was just driving home, and one of the things that Blake said during the sermon, he was talking about how if God could fix this or if God could fix that. And he said, he's waiting on us to move because we're the body. We're the body of God. We're the arms and the legs. And so I started thinking about that. And I'm like, you know what? I feel like we could make we have the potential to make a huge difference in Arkansas with our treatment center and how many residents we have there with this huge high school that we just bought. What can we do? And so I brought it up to Chris, and we basically just invited Blake out to do a tour. And he did the tour, and he was a little bit quiet at first, a little more quiet than I expected, but he said that on his way home, he got the feeling that, God was trying to do something bigger than we could ever imagine. And he said, it's hitting me pretty hard right now. And since then, we've had a few meetings, and we've decided to plant a church in that auditorium. And it's going to be called Natural State Worship. And we've already started our groups on Sundays. It's a separate entity than the rest of the treatment center because we're not a faith-based program per se, but we want to be able to offer that to our residents so that, our goal is for them to build a relationship with God and to find his presence with them while they're here. And then once they leave, they can hopefully stay connected to us. So we've been doing that the last few Sundays, and it's been pretty crazy and amazing. I mean, we're pretty proud and thrilled.
Yeah, never before has there been a blend, Senator, of combining secular treatment with faith-based principles. And so we're already seeing the fruit in that because, like Lindsay did say, it is optional for our residents there, but there hasn't been many people sitting out. When we've had two services already, and I'm just really humbled. I think that's the word I'm thinking of, is just seeing. Sometimes, Senator, I'm like, it's like God could have chosen anybody to do this, but he chose me, and he chose Lindsay to help lead this effort, and so we're just going along on the ride. I hope that makes sense, but we're just showing up.
Well, yeah, it makes sense. And you talked about what the pastor said on his way home, and I just kind of wrote down this comment. If God called us to do things that are smaller than he is, he's not much of a big God. God always calls us to do things bigger than we are, that he can make bigger than we would ever imagine happen. And I think it's all about being submissive. It's all about following his will, following his lead, and then stepping through those doors when he opens them so that he doesn't have to close it and give that open door opportunity to somebody else. Now, the campus, I've been out there, and I owe you a visit. I got to come out there because when I was there, they were, putting up the metal stud walls and hanging sheetrock, and I owe you a visit. But let me ask you, have you done an open house, or what if somebody just wanted to come see it? What's the processes? If somebody just wants to come see it, maybe they don't have a family member that has a need, or they don't have a need. They just want to come see it to kind of share in the vision. And then what if somebody does need what you have to offer in the way of recovery? And I want to get to that in just a minute as far as how that looks. But what about accessing the campus out there at the Old Oak Grove High School? What can people do, or how can they be able to come see what you got going on?
Well, you asked three questions. The first one is, what about a grand opening? We do actually have some information on that, and that is actually happening May 20th, and the event begins at 5:30 with dinner at 6. And so I've got a front row seat for you. You're not going to want to miss it.
May 20th at 6?
May 20th at 5:30 is when the event begins, and we'll meet in the auditorium, and then we'll have an outside dinner.
Okay.
It's nothing where it's like a 5-course meal, but it's going to be nice. And then we'll take people on tours from there. If someone just wants to come out and see it, I suggest calling our main number and setting up a tour. I can do that, and we have staff that's available to do that. That number is 501-319-7074. We want to have as many people out there that are curious about what's going on. Like Lindsay said, it's, we have a tough time articulating and painting the picture of what's going on out there. So our best answer is just come out and see it. It sells itself. you'll feel the presence out there. You'll feel the spirit in what's going on. And
let me give you and Lindsay an idea. Maybe what you ought to do is host an alumni night, because for everybody that ever graduated from the school out there, went to the school, I would think, having seen what it looked like 6 months ago and the direction you were trying to take it in, I would think that people would be excited to know that that building, that campus, was repurposed for something that is of great value to the community. And I know you had some questions out of the community out there when y'all went in, that you had to have the community meetings and everything. But is the community accepting of you now that you've got that presence out there?
Yeah, I think that, we feel like we're a part of the community. It's not this us versus them deal. I mean, we go to the neighborhood watch meetings and share our comments and concerns. And if anybody has any questions of us, we answer them. I think what that was just the fear of the unknown, change, and just having that sense of uncertainty of what's going on. I mean, it's a 27-acre campus. They had watched a previous owner bite off more than they could chew, and they couldn't materialize their vision and their intent with the campus. And so I think they had just a little bit of uneasiness about that. But now that we're up and running, and it's middle of April, we opened March 1st. A lot of those things have just naturally faded away. But yeah, we work with the sheriff's department. Actually, our real, before we even opened, maybe the weekend before we opened, we had the Pulaski County Sheriff's Office use our big parking lot, and we hosted a big food drive. And so that's what we set out to do. We want to, while we are doing the treatment and providing relief from addiction, we also want to improve relationships within the community and just be a good neighbor, right? And so it's nice that those things are happening.
Okay. Tell the folks, well, first of all, how many and what are we referring to your folks as, residents, or what's the proper term you're using?
Clients, residents.
Clients. Okay.
We have a medical director that's an MD and an APRN and a full nursing staff, and so they use the term patients.
Okay.
But we all know what the words mean.
Okay. So what's your capacity out there, and how many do you have now?
We have a capacity of 54.
Men and women?
Men and women.
Okay.
And that's a large facility, Senator. I don't know if you have any comparables, but our little boutique outpatient facility overnight became one of the largest facilities in the state of Arkansas. And so while we have a capacity of 54, we're holding steady right now till we can. When you take something from paper and you put it into material, there's some gaps and things you couldn't see around the corner. And so we're still polishing a few procedures and policies. And so we're holding steady between 18 and 22, which isn't bad for our just a little over a month. It goes to show you that people were just desperate for help. And I think last time I talked to you on the show is like, I want to be open yesterday, right? I mean, we know this pandemic has caused a lot of the recovery community to be in forced isolation, and really critical programs were shutting down, and our nation has experienced a lot of unnecessary death because of those things happening. So really and truly, the biggest takeaway that I can share with you today is we're just grateful to be open finally, because what we're seeing is what we knew. People were desperate for help, and that's the only way we can explain why we've seen those strong numbers this early.
Okay. Now you're doing the 30-day inpatient treatment, but then you also have the outpatient side of things as well. Is that correct?
That is correct. And I would just add that we have a full round-the-clock nursing staff that can offer detox for people. So they detox with us, and then move into residential, that 30-day program. So it's a little bit longer than a 30-day, and then they move into the next phase, which is outpatient.
Okay. Now, let me, with time I got left, let me go back to Lindsay for just a minute, because the Natural State Recovery Foundation, is that the fundraising arm of things outside of the grants and the other mechanisms you have in place to take care of the cost of the operations? What is the purpose of the foundation, in case people want to get involved and help out?
Well, I mean, there's going to be several goals. It's not going to just be one purpose. Like I shared with you before, the biggest thing is going to be my main goal right now is just to get scholarship funds, but we will be, grants will be involved. There will be a lot of other things. We've already gotten our founding donation that I was really excited about, and right now we're looking to put a board together as well. So I'm keeping my eyes and ears open and really looking for the right group of people for that. I want to keep it small, and I want to make sure that we have the right group, like I said, with, their values are in line with what we want, and we'll just see where it goes from there. Our purpose is to build relationships and, raise the funds for people. I think, Chris, what was the statistic?
Figure, but 90% of people who need or qualify for treatment don't get it. That means 10% of people actually receive the critical treatment they need to treat their addiction. But I'm going to just piggyback on what Lindsay was saying is, the foundation's all about removing barriers to accessing treatment. And so that's one of those main veins in our.
One thing, because I've actually come out there a couple of times when you were over on Markham. You had the facility located at Markham, and met a couple of times with some of your groups. One of the big challenges that I heard was that you get somebody who is interested in getting treatment. They reach that point that they're finally willing to surrender and say, yes, I need help. And that would require maybe that they would go for 30-day inpatient treatment. The problem is the bills continue to go on at home, and you've got family members behind, and it just creates a whole new level of stress. Do you, in the foundation, have anything in mind that would be able to help folks so that if they do want to come in inpatient, that would kind of help sustain, the ongoing expenses while they're there getting treatment? Or is that going to be incorporated in the foundation? Or are you still developing that?
No, that's a great statement, question. And yes, we want to be able to offset anything that could be a potential barrier for someone's access to treatment. I think Lindsay is, one of her major strengths is seeing someone where they're at and then building a plan for where they're going. And so each person is going to be different with their need, right? And if it's keeping an electricity bill on, there's probably going to be an application process that these people that are looking for treatment can share what their challenges are, and then we can help address those. But the foundation is where that happens, and she's focused on building those relationships to find. I mean, we want to. This foundation isn't just about raising money, right? It's also about putting people with and connecting their passion to what we're doing. And sometimes I think Lindsay has the best way to say that. Like when she's looking for the board, there's 3 things that she's looking for in a board member.
Door openers, doers, and donors. So I'm looking for, we've got Miguel Lopez. He's the only board member as of right now, and he's going to be helping me put a team of people together. And I've actually already got someone in mind for my doer, but I'm still, like I said, I'm praying about it, and I'm keeping my eyes and ears open. And I know that God's going to bring us the right group of people because, God has his hands all over this place. It's amazing. I mean, he just, like you were talking about with open doors earlier, Chris and I talk about it all the time because we have these crazy things happen during the day. Almost every day we're like, oh my gosh, that's insane. And we know it was only God. And so we just we were surprised at first, and now we just kind of laugh about it. And we're like, I think that kind of stuff happens because we've opened the door for it. We've opened every door in that place to let God flow through there and work in these people's lives, work in our personal lives, so that, you know, we're handling life the way that is led by example. And so we work really hard on that, and we just want to show, you know, we both went through addiction ourselves. So I think that's what our center has, you know, above others, is that most of our staff members have been through it, other than the nursing staff and our clinical director. And, you know, a lot of us have been through it. And so we know what it feels like, and we know what it takes to overcome it and come out on the other side of it as happy people who don't have to live in that way for our entire lives. It just sets us apart a little bit. And so we're just, like he said, super humbled to do this and just really excited. We have to pinch ourselves sometimes, so it's pretty neat.
Hey, I got to go here in a couple of minutes, but let me ask you about one thing, because, and I'm not sure where you are in it, Chris, but you were working toward that as far as a portion of your facility out there, or at least it was on your radar screen, to try to do something for high schoolers that are addicted and want to get help, but don't want to fall behind or need to catch up in their education while they are receiving treatment, because unfortunately it's dropping down to the younger generation as far as addiction, starting earlier down to the high school, junior high level. Can you speak on that real quick as to where you are on that part?
Yeah, I can do that for you real quick. But before I do, I just wanted to say one more thing to what you had asked earlier is, you know, our state is kind of special in the sense you have Director Lane coming on in a minute to talk about Arkansas Take Back, but him and his leadership and the governor allowing certain things to kind of stir up within Arkansas. And, you know, I've always said there's, you know, treatment in Arkansas was feeling a little antiquated in this status quo. And so with Kirk Lane's appointment to this position, it's just provided some strong leadership to this space. And so if he's listening, thank you for that, Director Lane. But as far as the high school is concerned, we've kind of had to put that in the proverbial parking lot, if you will. We're just trying to get this up and running and to get the structure and the things in place that can help our current population. But, you know, one of those ladies that was on the tour a few months back was kind of looking to spearhead that. And I just haven't been in touch with her in a little bit. I do know that you and I and some other leaders are going to be in a meeting with the Bryant School District here in the next month or so. And maybe we can talk about and brainstorm some ideas to help the teens. There's not a lot of resources for teens, and then there's not a lot of resources for pregnant women suffering from addiction in Arkansas. And so we hope that we can play a role in that, and we'll do whatever we need to do with that calling. But we're kind of just focused on our current adult population right now being so new.
Taking care of what's on your plate right now before you go to the next compartment of the multi-compartment plate. So, all right. So we've been listening to the Kim Hammer Show. My guests have been Lindsay Barclay and also Chris Dickie. Chris is the executive director, right, of the Natural State Recovery Center. Is that correct, Chris? I got your title right?
CEO. But yeah, that's right.
Okay. All right. All of the above.
Humble servant.
Yeah, there you go. And then Lindsay is the executive director. Is that the right title for the Natural State Recovery Foundation? If I got that right, Lindsay?
Yes, that's correct.
Okay. All right. So, and you're going to have the open house on May 20th at 5:30. Is that by reservation only, Chris, or how's that work? If somebody wants to come out there, what do they need to do? Just call your number you gave me a while ago, or what do people need to know?
Yeah, for this audience, call that number, 501-319-7074, and then we can register them on that. We're also going to have a couple of other mailers and digital mailers that has another way to register.
Okay. And then if somebody wants to see about getting their loved one, or they themselves want to see if they qualify to come out there to Natural State Recovery, they can call that 319-7074 number as well.
It's as easy as that. Yeah.
Okay. All right. Very good. Tell you what, if you'll email me your link to your website and all that good stuff, I'll get Elizabeth, who's probably listening. So, Elizabeth, let's get our stuff. Let's get their stuff on our stuff, and that'll help promote you. And we'll put that phone number out there to the it's the KimHammerShow.com website, and you can pick up that information off my website. And that was 501-319-7074 to the Natural State Recovery. And you can connect out there with Chris. And I have been out there, going to come back out there and see you probably before the 20th, Chris. Let me get out a session where I can breathe and come out there and take a look. But I'm proud for you and proud of what y'all doing. And thank you for taking a little time to be on the Kim Hammer Show. All right, we got to take a break. And then when we come back, we have Representative Dr. Lee Johnson on the line. But we also have Kirk Lane, who is the state drug director for the state of Arkansas. We're going to take about Drug Take Back Weekend, and we're going to just share a three-way conversation with Director Lane, Dr. Lee Johnson, Representative Dr. Lee Johnson, myself, about opioid addiction here in the state, some of the legislation that we have run or that is running, and just kind of marry it all together because Lee is a ER doctor, so he has seen things on the front line. And let's have a visit about that when we come back. You're listening to the Kim Hammer Show here on 101.1 FM. The Answer. Be back in a couple minutes.
Take The Answer with you anywhere with our free mobile app. 1011FMTheAnswer.com, Amazon Alexa, iHeart, or radio.com. Breaking news and stimulating talk. 101.1 FM. The Answer.
Turning 72 may not be a big deal for you, but it will be for the IRS. This is the year when required minimum distributions kick in, and you'll be forced to start withdrawing money from your IRA and 401k to ensure Uncle Sam finally gets his cut. And the financial consequences could be more than you know. Don't miss the David Lucas Show this Saturday at 10 a.m. and Sunday at 2 p.m. right here on 101.1 The Answer.
Hi, I'm Shane with Fence Masters. I wanted to tell you a little bit about our company. First of all, we are believers. Not only that, but we are a company of integrity. We do not just build fences, we build relationships. We're still taking care of all your fence needs, including gate operators, security fence, and residential fence. I'd love to visit with you about your next fence project. Call us today, 501-847-3700. That's 501-847-3700.
This is Dennis Prager along with fellow host Mike Gallagher. We both want to invite you to join us for the trip of a lifetime to the Holy Land this October. I personally can't get enough of the great state of Israel and its historical significance. Join us to be amazed and inspired.
Dennis and I have planned out every minute of this trip in detail with Salem Media Group and our trusted travel partner, Inspiration Cruises and Tours. You'll have the best experience imaginable. We're confident by October our trip will be safe, so register today worry-free until July 6th with no cancellation fees.
We'll sail on the Sea of Galilee in boats that are replicas of the ones Jesus sailed in with his disciples. Experience unforgettable cuisine and join us for an authentic Sabbath service.
It's something you'll never forget. Go to standwithisraeltour.com to register or call 855-565-5519. That's standwithisraeltour.com. Book worry-free until July 6th.
If you'd like a smartphone that's really smart, download the OnePlace.com app, the app that will inspire your faith daily and provide answers to the biggest questions of all. OnePlace lets you download your favorite pastor's programs and listen, even offline or in airplane mode, with easy connections to your Bluetooth speaker or dashboard. To download your free OnePlace app, visit the iTunes App Store or the Google Play Store for your Android device and search for OnePlace. That's OnePlace.
Take The Answer with you anywhere with our free mobile app. 1011FMTheAnswer.com. Tune in, iHeart, or radio.com. Breaking news and stimulating talk. 101.1 FM. The Answer.
Welcome back to the Kim Hammer Show here on Saturday on 101.1 FM The Answer. Thank you, Chris, for coming on with Lindsay, talking about natural state recovery. And you can go up to the website, thekimhammershow.com. And we'll get that information posted up over the weekend where you can call to see if you want to go out there and get a tour, or if you have a loved one that you think needs assistance with the drug addiction treatment, or you yourself need it. You can get that number that Chris gave us a while ago, and it was 501-319-7074, and they'll take care of you out there with their great staff that they've got developed and a great resource for folks dealing with addiction, which brings me to Kirk Lane, the state drug director for the state of Arkansas, and then Representative Dr. Lee Johnson, who, when he's not being a legislator, is an ER doctor. And thank you all for being on the Kim Hammer Show this afternoon. Let me start off with you, Dr. Johnson. I had you on the show a couple weeks ago, but tell the folks the area that you represent, and if you don't mind, if it doesn't violate anything, which hospital you're affiliated with that you provide ER services to.
Sure. So I represent District 75. That's here in Greenwood, Lavaca, Barling. We're just south of Fort Smith. It extends up into Mulberry and Kibler. And then I work at Baptist Fort Smith and Baptist Van Buren, two hospitals here in the River Valley. And primarily in the past, I've worked at Baptist Fort Smith, which was formerly Sparks Hospital, and I've been there since 1999, so about 22 years.
All right. Director Lane, I am giving you the right title, right? State Drug Director, Drug Czar, Drug Lord. What's the proper title, if you would?
The State Drug Director.
All right. All right. Poke at Kirk a little bit because he used to be the police chief down in Benton. We've known each other for a while, so if I can get a poke in on him, I want to get a poke in on him. But so how long you been the State Drug Director, Director Lane?
Since 2017.
All right. Very good. Let's do this because I don't want to get off the air and forget about it because I've talked about it. Drug Take Back weekend is next weekend. Is that right?
That is correct. The 24th from 10 to 2.
All right. And tell us about the locations and where people can go if they don't know where the location is. You've got a website or a source of information where they can go to check for their locality because Kim Hammer Show is worldwide. So, we want to make sure they know in their area where they are.
So let me start with that. The best way to find your location is go to artakeback.org. You can go in there and put your zip code or your address in. You can find the closest take back to you. On that day, we have probably well over 100 law enforcement agencies that will be participating in this program in some location in their community that will be on the site. But also, there also is over 250 24-hour take-back boxes all across the state, at least one in each county of the state.
All right. And as far as the drugs that they can take back, and what if people are anxious, about the type of drugs that they have, what is it that they can take to the drop-off either next Saturday from 10 to 2 or to one of those 24/7 locations?
They can bring anything that they want to dispose of, any expired medication, any unwanted medication. They can put it in bags. They can leave it in the bottles. It's all disposed by incineration through a commercial incinerator through the DEA.
And last time, how many pounds did y'all take up? It seemed like you had a pretty good day last time.
We average about 16 to 20 tons per take-back program. We just crested the 200-ton mark since 2010. We're at 206 tons as of the last take-back safely destroyed.
That is a bunch of medicine. Is that in comparison to other states? Where are we? Are we at the top, in the middle, at the bottom, or how do we compare against other states?
Per capita, we range between the third and the fifth state for the highest take-back and destruction in the nation.
Is that a reflection of the amount of prescriptions that are given, or is that a good thing that people are just getting their medicines cabinets cleaned out, or if they're done with their medicine, they're getting rid of it, or are there any indicators as to being that third to fifth per capita? What's that an indication of?
Without a doubt, there's already documentation that we are a high prescribing state, but I really think it's an indication, and what I use it as an indication of how good we're getting that message out there to people to monitor, dispose of their medicine safe. It's easy to do. So come on out.
All right. Shift gears. Dr. Lee Johnson, and I'm not going to say Representative Dr. Lee through the whole program because
you can reference me any way you want.
All right. So Lee, let me ask you. ER doctor, just because of the balance of perspective that you bring, both being a doctor but also passionate about things like the subject matter we're talking about today on the Kim Hammer Show. Give me your perspective as an ER doctor, and with the opioid crisis, what are your thoughts as far as balance, and are there things that we need to be looking at, especially with the legislation that went through this session that we've had before? Just kind of give us a view from the lenses of an ER doctor.
Sure. Well, first, let me commend Director Lane for the efforts he's made, and specifically as it relates to this drug take back. If I could just take a few minutes to plug that as well as you have. I can't tell you the number of times that you see in the emergency department, ingestions, overdoses, whether it's young kids. These leftover pills that you have sitting in your house, in your cabinet, there's a real potential for those to be a real problem for folks, and from a health standpoint with regard to get access to those. That has not gone away. We've certainly made strides in our state. I think the efforts that were made early in this crisis with the prescription monitoring program especially has gone a long ways to curb hopefully inappropriate prescribing, overprescribing of narcotics. Certainly in my practice, I can see in the emergency department the number of people we have coming in today seeking drugs compared to 3-4 years ago has decreased quite a lot. And I give credit to a couple of things. One is I think we are starting to make some headway with regard to opioid addiction in the state of Arkansas. And the other is you just, as a prescriber, having the monitoring program in place really did create a pause for those providers that were pretty reflexively prescribing opioids for acute pain and or chronic pain. It created an extra step that was important and was really eye-opening in a lot of ways. I had colleagues that were frustrated that they were having to stop and look people up on the monitoring program, and turns out a lot of times they were surprised when they looked them up about how often some of these patients were getting prescriptions filled for narcotics, and I really do think that's made a big headway. Of course, when you start taking the commercial opioid products out of the marketplace because of less prescribing, then you start to see some problems with some of the more illicit drugs coming into our communities. I know in our community we've seen more heroin, fentanyl overdoses, those drugs coming into the area as drugs of abuse, and so again, I just want people to know while we're making some headway in the fight's not over by any means.
With regards to the prescription drug monitoring program, for those people that are not aware of what that is, between the two of y'all talk about that, both you as a physician who has to check it, but also Director Lane, you who helped get it to where it is today. And then let's talk about where do we need to go to the next level in order to make sure it's being utilized to the full potential to help address the issue.
I'll let Director Lane speak to challenges of rolling that out, and then maybe I can speak to the place we're at today with it.
All right, Kurt, go ahead.
So everything about the solution to the opioids or drug abuse and healthy lifestyles is really about education. And the prescription drug monitoring program, was kind of demonized because it was changed. That was anytime you make change, it's difficult. But what we did find is we realized that we wanted to give physicians and people that prescribe a good way to check to see what their patient is doing to make a good prescribing decision. It wasn't so much about the policing of it. It wasn't so much about that. We knew it was an effective tool in doctor shopping that was going on where a patient or a person was going from doctor to doctor. So we know that we've seen the results of the reduction in doctor shopping cases that we have across the state, which is a plus. And then also, I think the medical boards that are in charge of policing prescribers can use it as a base to further educate those prescribers to get them in a correct line. And education is key, again, to resolving a lot of these problems.
And I would agree. I would say that, initially there was a lot of pushback among some of my colleagues just because it was perceived as, more work, another step in what is already a busy day. But I think pretty quickly after the rollout, I was getting feedback from some of my colleagues in the medical field of how surprised they were. As they started entering in and looking at the program, what it requires is you have to, before you can write a prescription for an opioid, you have to get on the prescription monitoring program, look up the patient, and look at their profile and see, it give you an idea of when, if at all, they have had a opioid prescription filled in the past, and that step for some folks was revealing in the sense that you were surprised. I several times I was surprised. I logged on and was like, oh, wow, this guy just got, 90 pills filled a month ago, and here he is in my ER, wanting more for a different reason. And I think a lot of my colleagues had that same experience. And so I think at this point, most of the physicians are embracing the PMP process, and I think there is opportunity to grow it. Director Lane and I have talked about other drugs that are out there that are of some concern. Adderall is a drug that we're seeing now. At least I think I'm seeing being abused and potentially overprescribed. And so, it's a good tool for physicians. It's a good tool for the medical board, and I think there is some opportunity to look at expanding what we do with the program as we move forward.
So let me ask you, if I'm a patient and I walk in and I need some pain medicine from my doctor, would it be appropriate for me to say, did you check the PDMP before you wrote that prescription? Would that, what reaction might a physician have, or is that something that somebody ought to ask? I mean, naturally, if I'm not a abuser, it's not going to be an issue, but it would be interesting to see what the reaction might be.
Yeah, I would say that very few of the patients are going to be informed to the point where they're going to ask that question. If you come into my ER and you've broken your ankle, or you have a big kidney stone you're trying to pass, few patients are going to question if I write them a few opioid pain pills to get over that crisis. If asked, though, I think most physicians they'd be surprised because they don't feel like patients are too informed in that prospect, but most would receive that question well, and should say, yeah, of course we checked it before, as we are required before prescribing this medicine.
As a ER doctor, you are limited as far as, if I remember right, you are limited as far as how much pain medicine you can give on the script that they can get in the ER. Am I correct on that?
Yes, there's a limit, but it's funny because when that limit was set, as a practitioner, I think most of my ER colleagues would agree. We're always, when I write a prescription for a narcotic pain medicine, it's always been a short course. I've never written for more than a few days worth because I'm treating acute pain, and my expectation is that they're going to have some follow-up with the provider other than me, whether it's an orthopedist, if it's a broken bone, or if it's some sort of kidney stone or some other acute injury. My expectation has always been that it would be a short course of pain medicine. So the limit on how many we can prescribe or how much we can prescribe really has never been something that affected my practice and probably most of my colleagues, because we were already in the habit of writing very short courses. I think there was Kirk mentioned education. There was some true ignorance on the probably 10, 15 years ago about what a problem this really was becoming. And so it was not unusual for a surgeon to operate on somebody and then post-surgery give them maybe 90 pills, or just to make sure they didn't have to get calls back, and no one really thought that was creating any harm or problem. And so the education in the physician community on this issue has really been on a steep curve the last 5 years, and I think our medical community has responded to that in a very appropriate way and changing their practice patterns. Certainly, as with any profession, a little resistance to change out of the gate, but I think we're making really good progress now.
You mentioned about surprise when you went up and checked as a physician. Do you think that there's also a degree of disappointment? Because one testimony or a couple of testimonies I remember when this was going through the hopper about a physician who had a friend that, trusted like a brother, and came in one day and he went up and checked the PDMP and found out that that real good friend was actually doctor shopping and getting several prescriptions from other doctors as well. Can it be as much of a disappointment as it is a surprise to physicians sometimes?
Oh, certainly. You always want to think the best of people, and in fairness to these folks, I think this was a common conversation when this was coming out. This is the people that were and to some degree still are addicted to these pain pills. These were not people out on the streets. These were your neighbors and people in your community who, through sometimes no real intent of their own, had just become habited to these pills that they were appropriately prescribed. And then, once you become addicted, it is a difficult thing to wean yourself off of them. There's a very physical addiction to these medicines and a very physical withdrawal to stopping. And so it's not just as simple as just, flipping a switch and I'm going to quit taking these. And so, for me, I have a lot of empathy for a lot of these patients who had become addicted to the opioids because, I don't think these were people that were out trying to get high. These were people that were appropriately, taking their medicines and then just, didn't realize how quickly it can escalate to a problem.
Okay, I've got 3 minutes left. So first of all, Kurt, let me give you one of the 3 minutes left about the big push you have. I think it's Narcan. Is that right? Is that the drug that you're trying to get in everybody's hand?
Yes, we have a series of Narcan programs going on. If you want to get involved, it's as easy as downloading the Narcansol app, which is an exclusive app that we developed for Arkansas. You can tune in to all the programs. You can train yourself. You can go and purchase Narcan on your own from a pharmacy, and we got that passed a couple of years ago. But it's really making a difference. We're tabulating about 11 people a day in Arkansas are saved with Narcan by our EMS and our police programs that we have. So it's a big deal, and it's changing. It's what Surgeon General Bledsoe said. We got to find a way to stop the carnage, and Narcan is doing that.
Good deal. And get me the link on that stuff, and I'll get it up on the KimHammerShow.com website so people can get that information. I know you've given that out before. The last thing, too, is on physicians with regard to the PDMP. There's a report card out that actually scores so physicians can see how they compare against other prescribers. Is that correct?
That's correct.
Yep. Okay. All right. So you've been listening to Kim Hammer Show, and we've had on State Drug Director Kirk Lane and also Representative Dr. Lee Johnson, who's a ER physician when he's not up at the Capitol legislating, which he is a very proficient legislator. Let me tell you, very, very proud of the work that he's doing. Serves over in the Baptist ER over at Fort Smith and in Van Buren. Remember that the drug take-back program is next week from 10 to 2. You can go up to artakeback.org, artakeback.org, and plug in your zip code. It will give you the closest location. Nobody questions you. Nobody shakes you down. Nobody embarrasses you. If you show up, in fact, down Benton, you just have it in a plastic bag, drive through, and they'll take it, and you just move on down the line. No pictures, no recording, none of that stuff. There's no reason for you not to clean out your medicine cabinet. And just remember this, too. You may not think that your little darling gets into your bottle of medicine, but why not remove the temptation to protect your little darling and not give them that opportunity and clean out those drug cabinets, get all that stuff gathered up, regardless of whatever it is, and get it to the state drug take back program next week, 10 to 2 o'clock. All right, Director Lane and Lee, Representative Lee Johnson, thank you all for being on the Kim Hammer Show, and look forward to seeing you around at the Capitol next week. All right, you've been listening to the Kim Hammer Show here on 101.1 FM. If you want to stay in tune to some of the current events, go up to the KimHammerShow.com website, and you can follow along, and you can also just log in there if you want to advertise on the show, or you got anything you want to put up there, just let me know. Thank you for listening. Have a great day.
101.1 FM, The Answer. KDXE FM, Kamak Village, Little Rock, a Salem Media Group. 101.1 FM, The Answer.